Imagine if your mind became a maze, your thoughts tangled, your reality distorted, your sense of self scattered across 1,000 voices. This is not fiction, this is schizophrenia, a deeply misunderstood and often feared mental illness that affects how a person thinks, feels, and behaves. In this video, we're going to look behind the curtain, to understand what schizophrenia really is, to separate myths from facts, and most importantly, to humanize an illness that has long lived in the shadows. Let's begin this journey of compassion, science, and truth. What is schizophrenia? Schizophrenia is a chronic, severe psychiatric disorder that affects a person's ability to think clearly, manage emotions, make decisions, and relate to others. It is not a split personality. That's a common misconception. The word schizo means split, but it refers to a split from reality, not a split identity. At its core, schizophrenia is a psychotic disorder, meaning it involves loss of contact with reality through delusions, hallucinations, and disorganized thinking. The symptoms: positive, negative, and cognitive schizophrenia symptoms are grouped into three main categories. 1. Positive symptoms, things added to normal experience. Hallucinations, most commonly auditory, hearing voices no one else hears. Delusions, false beliefs, for example, believing you're being watched or controlled. Disorganized speech, jumping from topic to topic, incoherence. Bizarre behaviors, unusual postures, agitation, or unpredictable actions. 2. Negative symptoms, things missing from normal functioning. Flat affect, lack of emotional expression. Anhedonia, inability to feel pleasure. Alogia, poverty of speech. Avolition, lack of motivation or initiative. Social withdrawal, avoiding contact, seeming emotionally distant. 3. Cognitive symptoms: poor executive function, trouble understanding information and using it to make decisions, difficulty concentrating, short attention span, confusion, working memory issues, trouble remembering recently learned information. Together, these symptoms can cause significant disruption in work, relationships, and self-care. Real-life example: meeting James. Let's meet James, a 24-year-old college student. James was bright, creative, and passionate about film. Over the past year, his friends noticed changes. He became withdrawn. He said the television was sending him coded messages. He began mumbling to himself. He stopped going to class. Eventually, James told his mother he was hearing voices that criticized him constantly. He was convinced his professors were spying on him. James was hospitalized. He was diagnosed with schizophrenia. This diagnosis didn't end his story. It gave it a new chapter. A chapter of healing, of learning, of redefining what it means to live with schizophrenia. What causes schizophrenia? We don't know the exact cause, but research shows it's likely a complex interaction of 1. Genetics. If a parent or sibling has schizophrenia, your risk is increased. No single gene causes it. It's a combination of many small genetic variations. 2. Brain chemistry and structure. Imbalances in dopamine and glutamate may contribute. Brain imaging shows differences in brain size and connectivity. 3. Environmental factors. Prenatal exposure to viruses, malnutrition, or birth complications. Childhood trauma or abuse may raise vulnerability. Cannabis and drug use in adolescence may trigger symptoms in genetically predisposed individuals. It's not about bad parenting or weakness, it's a brain-based condition. The course of illness, onset and phases. Schizophrenia often emerges in late adolescence or early adulthood, typically between ages 16 and 30. The illness usually progresses in phases: prodromal phase, subtle changes, withdrawal, unusual thoughts, mood swings, poor functioning. Active phase, psychotic episode, full-blown symptoms like hallucinations, delusions, and disorganized behavior. Residual phase, positive symptoms fade, but negative symptoms linger. Functioning may improve but rarely returns to baseline without treatment. Some individuals have multiple episodes with periods of recovery, while others may have chronic symptoms. Early detection and intervention matter a lot. Diagnosis. How it's made: schizophrenia is diagnosed by a mental health professional, typically a psychiatrist. There is no blood test or brain scan that can confirm it. Diagnosis is based on clinical interview, symptom history. Duration must persist at least 6 months. Ruling out other conditions like drug-induced psychosis, bipolar disorder, major depression with psychosis. Sometimes collateral information from family or friends helps. Diagnosis can be difficult. Schizophrenia shares symptoms with many disorders. Careful evaluation is essential. Treatment options. A multimodal approach. There is no cure, but schizophrenia is treatable. 1. Medications, antipsychotics. First-line treatment to reduce hallucinations and delusions, typical first-gen haloperidol, chlorpromazine, atypical second-gen risperidone, olanzapine, aripiprazole, clozapine. Side effects can include weight gain, sedation, tremors, and more. Medication adherence is often a challenge due to side effects or lack of insight. 2. Psychotherapy, CBT for psychosis, CBTP, helps challenge distorted thoughts and improve reality testing. Supportive therapy builds trust, provides structure. Family therapy educates caregivers, reduces relapse. 3. Psychoeducation, teaching patients and families about the illness helps with insight and management. 4. Social and vocational rehabilitation, helping patients return to work, school, or community life. Supported employment and social skills training. 5. Hospitalization, needed during acute psychotic episodes or if there's a risk of harm to self or others. Recovery doesn't mean being symptom-free. It means living a meaningful life despite challenges. Insight, or lack thereof. One of the hardest parts of schizophrenia is anosognosia, the inability to recognize that one is ill. It's not denial, it's a neurological condition. The brain can't see its own dysfunction. This makes treatment hard, because how can you treat a condition you don't believe exists? That's why empathy, not argument, is key when supporting someone with schizophrenia. Stigma, a cruel burden. Schizophrenia is one of the most stigmatized mental illnesses in the world. Movies portray people with schizophrenia as violent or dangerous. But the truth is, they are far more likely to be victims than perpetrators of violence. Stigma leads to shame and isolation, avoidance of treatment, discrimination in housing or employment, broken relationships. We must replace fear with understanding and stereotypes with stories. Schizophrenia and violence. Fact vs. myth. Let's address a tough question. Are people with schizophrenia violent? In reality, the vast majority are not violent. Risk increases slightly if untreated, if substance use is involved, or if the person is in an acute psychotic episode. People with schizophrenia are more likely to be harmed than to harm others. We must avoid sensationalism. We must advocate for treatment, not punishment. Successful people with schizophrenia. Despite the challenges, many individuals with schizophrenia have lived creative, productive, and inspiring lives. John Nash, Nobel Prize-winning mathematician, lived with schizophrenia. His story inspired the film A Beautiful Mind. Elin Sachs, a law professor and author, lives with schizophrenia and is a vocal advocate for mental health rights. Many others lead quiet, successful lives as artists, teachers, parents, workers. Their message is clear: recovery is possible, hope is real. Living with schizophrenia, daily struggles and triumphs. Living with schizophrenia can be exhausting, not just from symptoms, but from judgment, from internal battles, from navigating a world that often doesn't understand. But there is strength in survival. There is dignity in persistence. Support from family, community, and mental health services makes a profound difference. A message of humanity. To those who live with schizophrenia, you are not your diagnosis. You are not defined by your hallucinations, your medications, or your setbacks. You are human. You are worthy of love, of safety, of purpose. And to everyone else, the time for silence is over. Let us speak. Let us educate. Let us listen. Because schizophrenia is not a life sentence. It's a journey, and no one should have to walk it alone. Thank you for watching. Let's keep the conversation going.